All right, welcome back to Western New York Living. When people hear the word concussion, they have a tendency to worry, and rightfully so. If you're a parent and you fear your child may have concussion, worry might turn to panic. Now, joining us now from the UBMD Physicians Group is Dr. Osman Farooq, whose specialties include child neurology to help us better understand concussions, especially in our children. Doctor, great to have you here.
Thank you for having me.
Well, what are some of the signs parents should look for when it comes to their child and concussions?
So after a head injury, if there's ongoing significant headaches or nausea or vomiting, any change in their mental status, so if there's confusion or change in behavior or ongoing dizziness, then they should seek medical attention.
Yeah, and sometimes, you know, there's only questions parents can ask, right? When we put our hands of our kids, my kids play sports, put them in the hands of a coach or a trainer there might be things that they don't know that we know to ask,
Sure.
Correct?
Absolutely. Yes.
So what should the protocols be for parents if they see that their kid has an injury or you know, hits their head in a sport, let's say hockey, we're into hockey season, and they go into the boards? What should parents do?
Well, immediately it would be good to assess them, see if there's any kind of problems with their coordination, if they're having any kind of headache or anything, and not rush to return to play. I would give them a generous amount of rest to make sure that they're back to themselves and able to function appropriately.
You know, I mentioned the sport of hockey. What sort of sports and what sort of activities are you seeing patients and kids come in with concussions? Because I think people think, oh, it's just hockey or football. That's not the case, is it?
Right. Well, football, I think, is the most common sport that I see. But I do see a lot of hockey, and cheerleading is another common one that I see a lot of head injuries.
But really? Cheerleading?
Cheerleading. It's a very violent sport. And I have a huge amount of respect for cheerleaders because they train very hard and they work hard and they're not fully padded like hockey and football players are. So, you know, they do the tumbling, they get thrown in the air, and even the people who catch them, the base of the flyer, they can get injured frequently.
Wow.
So.
Soccer is another one, too.
Soccer is another one, yes.
Wow, the sports that perhaps we don't think about. What can parents do to help prevent concussions? Can they be prevented?
Well, everybody is going to hit their head at some point. All sports are, you know, it's assumable that somebody will fall or collide with another player. So we can't always prevent head injuries, but we want to take precautions. So if they're playing a sport where a helmet is used, then having a good quality helmet will be good. Also, if there are sports such as soccer where heading is not always indicated, there's other ways to get to the ball, that would be a wise thing to do also. So trying to limit the impact to the head is always good.
Yeah, don't practice the headers, for sure. When should they seek medical attention? You mentioned signs to look for. At what point do parents come and see you and seek medical attention?
Well, certain red flags after a head injury would be vomiting, loss of consciousness, or any prolonged confusion. So if any of those signs are there, it would be good to seek immediate medical attention. But if the headaches are ongoing for more than a couple of days, or they're really having trouble getting back to school or back to their normal routine, then it would be good to either reach out to their pediatrician or to our concussion clinic to be seen soon.
Yeah, which makes sense. This is the brain we're talking about in your child's brain here. Doctor, great stuff here. If you'd like more information on Pediatric Concussion Clinic at UBMD Neurology, you can head over to their website at ubmd.com. There you find information on all the services the UBMD Physicians Group offers. Dr. Farooq's office is located at 5851 Main Street in Williamsville. You can also call 932-6080 to speak to his helpful staff.